my psychological disorder was body dysmorphic disorder. The definition is when a patient is so focused on one aspect of their body and they solely just dwell on how it's not perfect or how they can fix it or how they think other people view it. They think it can't be fixed and they always think that it can't be fixed. Either way, they just dwell on it so much it takes over their mind and it's just what they think about. They go to work, they think they're staring at me. Oh, they're pointing fingers at me. Characteristics of this disorder is thinking you're ugly or you're deformed or you look different than somebody else. You look different from the person sitting next to you. You see yourself the way you think people see you, but in reality, it's people see you as human. It's not people. The reality is people aren't pointing fingers at you or looking at you weird. They just think you're a normal person like themselves. The history behind this disorder was called dysmorphophobia. An Italian physician researched it and discovered it. And after, in the 1990s, they changed the name to body dysmorphic disorder because it just fit well with more of the diagnostics and the characteristics behind it. Symptoms that people have with this disorder is that they think they have a defect in their appearance. They attempt to hide the flaws with baggy clothes. They put on pounds and pounds of makeup. They try to cover pimples or birthmarks or beauty marks or birthmarks. They're always seeking reassurance from everybody, asking how they look, how they're dressed. Do you like this? Do you like that? What don't you like about my outfit? What can I change about my outfit? And a lot of the times, a major symptom of this is trying to avoid social scenes as best as possible. They don't like big crowds. They don't like parties. Because they think that everyone will notice a flaw, like their hair doesn't look right, their makeup is off, their outfit is off. And another one is they seek out plastic surgeons to fix what they think is imperfect. They get a facelift or plastic surgery on any body part they think is wrong. The cause behind this disorder is unknown. Researchers say it can be from anywhere from mental health problems to family history, abnormalities in the brain, or even like being bullied or made fun of in school at a younger age for the way you look, the way you dress. They look into your family history to see if anyone else in your family has had this. They look at your brain scan. They look at all the different parts and see if there's anything different about it than what a normal person's brain would look like, to see if there's anything about it. There are some treatments to this disorder. There's one, the cognitive behavioral therapy has been a big treatment for this disorder. They teach you how to maintain those bad thoughts in your head. And they teach you how to deal with those bad behaviors, thoughts. They how if that thought came up, just push it out. Just be like, no, you're not getting to me today. And teaching you how to control your mental health in social events. So it's a big part. They say that this cognitive behavioral therapy is one of the best ones. The cognitive perspective has been a big part of the treatments they offer, how to maintain, maintaining those bad thoughts. This one just teaches you how to still be there and actually be there. Like, you can't, some people with this disorder are there, but they're not actually there. The psychodynamic perspective of this is not knowing when your disorder is a big problem, like not knowing how far you can go without getting treatment. The behavioral perspective is, again, they just knowing that you are perfect the way you are. They teach you that you're perfectly fine. You just need to know that and help yourself understand that you are perfect the way you are. Another big medication that can help is selective serotonin reuptake inhibitors. It is claimed that it helps people with this disorder control the negative thoughts and repetitive behavior. And it is prescribed by a healthcare provider. You can only get it through a healthcare provider. They want you to be able to just take it from them and not get it from over the counter. Other medications can be prescribed, but health providers will start with selective serotonin medication. They say that this drug is improving the transmission of the neurotransmitters that they find if they find anything wrong with your brain, or like if you have any abnormalities in your brain. They say 1 in 50 people have this disorder in the United States. They also say typically people don't talk about it as much as they should. A lot of people that have this disorder will put it under wraps. They won't talk about it. Society plays a major role in this because people that have this disorder will not go out as much as people without it. Like, they don't want to go to a big social scene because they think people are pointing fingers at you or saying, oh, look at her or him. You'll think to yourself all the negatives that are happening. So a movie that has to do with this disorder is the movie Looks Can Kill. It was made in 2000. The director was a former sufferer of this disease, the body dysmorphic disorder. He was given unique access to story of a 21-year-old that suffered from this disorder. However, the movie was based on how it affected her life and how she dealt with that through her life problems. It also showed how acute isolation, self-mutilation, and some suicide attempts have affected people with this disorder. It hasn't always been easy with people like this. So in a day in the life of a person with body dysmorphic disorder, so it's a Friday normal work day. You get up, you get dressed, and you're getting dressed, you're picking out outfits, and you're saying, well, this doesn't match, but they perfectly match, they coordinate. Your brain is just telling you that it's not going to match. People are going to make fun of you. People are going to look at you funny because you think it doesn't match, but in reality it does. You can't form you don't have a relationship, a romantic one, because you don't think anyone will love you by your looks. Again, in reality, someone will love you for the way you are. You gotta wait. Going to work is very difficult for this person. Seeing people thinking they're whispering about you is very hard for this person mentally. You go throughout your workday being really conscious of what you eat because you think you can gain weight from just eating a salad or eating whatever you eat for lunch. You go home, like, your family life, you have a good family life, but still you think of those negative thoughts when you're around your family because you think, oh, they all look this way, I look different. Like, then you get towards the end of your day and you isolate. Like a Friday night, typically a lot of adults go out with their friends and you stay home because you don't want to go out to that big social scene because you think you look like this. So yeah, that is all I have on body dysmorphic disorder. Thank you.